Welcome to the next installment in AlertFind's webinar series. Today we are talking about pandemic readiness, how to build your communications and training plan. You can join the conversation on Twitter using the hashtags emergency preparedness and AF pandemics, and we will also be live tweeting this conversation at alertfind.com. I am so pleased to introduce our speaker today, Meg Nash. She's an emergency preparedness expert and the principal consultant for Helion Solutions, which is a seasoned business continuity professional with a comprehensive background in emergency response, disaster preparedness, and public health. She's worked with businesses to implement continuity plans for more than 10 years and has more than 20 years of experience in emergency management and response. Meg is a certified FEMA instructor and a highly rated speaker and presenter. She holds a Master of Public Health and a graduate certificate in emergency management and public health, both from George Washington University. And I will be your moderator today. My name is Danielle Ricci. I am the Senior Director of Marketing at AlertFind. Today, we're going to cover how to create a comprehensive communications plan, identify the right messages and channels for employees, customers, and vendors, continue business operations while employees are working remotely, use two-way communication to do well checks and monitor the status of your employees, and test your communications plan during training exercises. Meg, welcome. Thanks so much for joining us.
Well, thank you for having me. I'm looking forward to it.
Awesome. So I want to just jump right in and ask you, how can businesses start constructing their communication strategies for pandemics?
All right. Well, that's certainly a good place to start. One of the things that I always find when I'm working with people who are embarking on this journey of developing a strategy for communicating pretty much about anything crisis related is really trying to figure out what does the company or organization want to do? What is their perspective on this? What's their corporate take on what this is? And really to focus more on everybody when they start this, they think, writing a plan and those kinds of things. Really, I look at it more of a sort of a voyage of finding answers to things and documenting them. So less about the format and more about the content. Which sometimes puts people at ease that they're not too far behind the eight ball when they start this. But, one of the first questions that an organization really needs to define is, when I'm looking at this, I have to assess my risk. And just like any other crisis or business continuity issue, we really have to look at, what is it that we're trying to offset? What risk are we trying to mitigate or reduce? How is this going to affect my business's ability to function? So, if you looked at a risk like an earthquake, it would be obvious of what things could happen that would affect your ability to function. But when we're talking about pandemics, we're looking at things like extended absenteeism. You may have that both for sick employees or people within your organization, as well as caring for their family. And you also have to look at, what are the steps that you can do to help prevent that, but then that affects your business as well. So you have to look across the board at what is it that I'm trying to prevent? Am I trying to keep people at work? Am I trying to keep everyone working? And we'll talk a little bit later, I think, probably about working from home and how that can help. But what does a pandemic affect most? Now, one example would be a manufacturing setting. So in manufacturing, you can't really spread people out too far. They're working on machinery. They're working on computers that have to be there. So, does that make it more of a risk because I have a lot of people in a small area? Is a loss of manufacturing employees, whether it's absenteeism or whatever, is going to affect my ability to create product. Now, if we're looking at something that's more of a scientific or a research, someplace where you'd have highly skilled workers, oftentimes those people are non-replaceable. So protecting that intellectual capital that you have and those highly skilled workers gets to be a really big concern. and also wide exposure. So if you have a lot of people, if you have a very large organization, just the number of people that potentially could be exposed. So really starting with that basic question. The other thing to look at are locations. So it's one thing if you are located in one basic geography, one state, East Coast. But when you start looking at multiple locations, the pattern of disease is different. So if you're up north, you're going to have a lot more people inside a lot more during the colder months when the flu tends to spread. If you're down south, it may be different. You may have other things that you're concerned about in the southern regions. If you're international and you've got multiple locations, then you've got the challenge of an evolving, sort of a rotating schedule of dealing with pandemics. Obviously, and some of you may know, the flu we're dealing with this year started basically in Australia. They experienced it before we did. We knew it was going to be bad this year. And they're already experiencing the next wave of the flu now. So as we're just barely coming out of our flu season, they're already starting. So you can imagine if you're a company really looking at, where your exposures are and what that cycle looks like. But specifically with communications, you've got to look at the cultures you're dealing with. And again, if you're in multiple locations, that plays into it. But as you're trying to think about communicating with your employees, whoever it is, your stakeholders, thinking about what that culture is of how are you going to provide information to them? Are there culturally appropriate or inappropriate ways that things could be phrased from a corporate level that you have to be sensitive to? And start there. The easiest way is to really look at a group of champions who are going to say, you know what, these are people that really care about this. Let's get a working group together. Let's start talking about what are the kinds of things that we need to be looking for. At what point would we want to consider, I call them triggers, at what point would we want to start talking to our employees and letting them know that something was going on? So am I waiting until there's an announcement by CDC? What is it that I'm waiting for before I start that communication process? And that all has to be within your plan. And additionally, you want to have representation on this working group from as many different corners of the organization as you can. And you really want different perspectives. You don't want just the communications team working on this, though they certainly can be helpful when you're looking at how to phrase certain things when you get more into that nitty-gritty of designing those.
Awesome. Well, that takes me into our next question, which is how do we design those communications, whether they be alerts, employee, customer, or vendor messages, and how much of that can be pre-planned?
Yeah, so obviously if you've got different audiences that you're going to be sending messages to, you're going to want to have those messages phrased a little differently. When you're talking about something that's going out to an alert to an employee, obviously you're going to give them different messaging, and you really want to think from the perspective of what do I want them to know and what do I need back from them. So sometimes you need to know, you may want information back of whether they're sick or not. You may be doing well checks on your employees. You may want to poll employees and see how many people have gotten a flu shot. So you really need to think about what of that messaging that you start to craft, what do I want to push out to them? And keep in mind that the information you push out to anybody, especially if you're looking for them to take action on it, and even more so when you've got a crisis or an emergency, that you need it to be a small bit of information. And it needs to be concise, and they need to feel like this is reliable information. So if you can, include primary sources, links back to, CDC or a health department, or we'll talk about some of the other reliable resources, but really small bits of information and providing those on as many channels as you could. So, if you've got email, obviously for your internal folks, if you've got an alerting system that you can use as well, and then maybe, send out, whether it's something in writing, you really want to approach on multiple channels that they're familiar receiving information, but if it's important, you have to do it across multiple channels. A lot of the things that you can do as far as pre-planning, again, you're going to have a good sense that a pandemic is coming. It's not something that's going to surprise anyone. They do move relatively rapidly from a health perspective. But as far as the speed of business and things today, it's much slower than we're used to. So what I would suggest is having holding messages. A lot of times holding statements or messages are things that you can have ready and approved through the process, however your communications get approved. So that the messaging would say, we're aware of the situation, we're monitoring it. A really good thing to have pre-planned are reminders of whatever you've got available to them. So if you normally run a flu clinic, if it's going to be a particularly bad year and you want to start running a flu clinic, if you work closely with your local health department and they're going to have a flu clinic, whatever it is that you can, provide to them, whether it's, new for this year, if you want to expand it out to their families when traditionally you haven't, those are statements that you can, having a reminder of what that program is something you can have pre-planned. And again, the trusted sources, you can definitely provide links to those and have that ready to go in a pre-planned message where you can say, we know the flu season is coming up. We hear it may be particularly bad. Here are some sites you may find handy to find reliable information, because you can imagine with as sensational as a lot of media gets these days, regardless of the topic, that if we had an extremely dangerous flu situation, there's going to be a lot of misinformation. So just reminding people where they can get good information is a good thing. And another idea that's always good, especially HR likes this, any human capital folks, if you've got employee assistants, is reminding people about best practices. We joke coughing into your elbow, putting signs in the bathroom to wash your hands. Pretty much everywhere we go now, you see the little mobile stations where people can get sanitizer. So considering, adding those to your public areas, especially where people can eat. Maybe having the surgical masks available, and just say to somebody, hey, if you've got a cough today, but you had to come to work, consider putting one of these on to protect your fellow workers, whatever it is, but reminding them of the best practices and making it as easy as possible for them to take advantage of those while they're at work.
Great. And my next question is, how can organizations best use an emergency notification system in these kinds of communications?
Sure. So, emergency notifications, the one thing we want to avoid is message fatigue. So we don't want everything to go out across, some sort of alerting platform. But using that frequently also makes people less likely to shiver and run when something comes in. So really making them actionable type things. Emergency notification systems are great if you're setting up an alternative schedule. So reminding people if you're gonna move to shift work, where you may have a time where if you're looking at social distancing, let's say if you're in an office setting, to get social distancing effective, that you've got to have 6 feet in between people, you may want to actually split them into shifts so that you can skip every other desk, every 2 desks. So, things like that, you could certainly message that out on an emergency notification system. If you're going to implement a work from home project or work from home policy change, and say, we're now activating that. And again, if there are changes that have come up, if there's a vaccine available, if you're going to be providing a service, pushing that out through that is helpful. Now, keep in mind that the notification systems, who's going to be receiving that? So if you typically have it set up for employees, in an event like this, the health of their families is also going to be paramount to them. So you may want to set up a separate channel that goes to the family members in case that the employee is sick and isn't able to, pass that message along. But really just to give them a sense that the business is taking care of them and addressing their needs, not just as an employee, but as a person with a family. So maybe creating an additional group. And you can do the same thing for customers or vendors. I always remind people that a lot of times you have people in your office that don't necessarily work for you. They may not be employees. So considering if you've got interns, if you've got, sometimes you'll have vendors or suppliers that actually work in your space, figuring out how to handle them, and if you need to add them to a separate messaging group as well, so that they're aware if an office is going to be closed, if you've changed your your policy on if you've got a fever over 100, now we want you to stay home, that kind of thing, just so that nobody's left out and you end up with, people that didn't get the message.
Right. And how do hotlines fit into all of this? Could you set up a hotline so that employees could get additional information?
Absolutely. And, and I would definitely suggest that, because hotlines really make it so that information can be aggregated and put together. So like you said, somebody can reach out and get the information. So it's more of a pull system. You can certainly do that again with hours if you're having a group that may shift to shift work, or if you're going to limit some people who are coming in. Again, with the family assistance, you may want to provide links to websites, phone numbers for insurance, things like that may be a redundant question that people may be asking. Additional resources within the community or where they can find assistance. A lot of that could be put on a hotline. You can consider doing it as a recording that somebody could listen to, or set it up internally where the hotline is available. I would suggest having a different one for vendors and suppliers, especially if you're talking about your customers that may be expecting product or things like that from you. If there are going to be delays, certainly your account representatives can reach out to them. But having a place where they can call in and just kind of get a status of, is manufacturing up and running? Are you still holding this event? So that you're not answering the same question, 200 times. One of the big things, though, with a hotline is really identifying what that trigger is to activate it. So are you going to say, here's what I would use the hotline for? Again, back to the whole communication side, what's going to trigger it? So is it going to be, we've reached 15% absenteeism, or we've been notified by the local health department that public activities should be canceled? What is that trigger, so that when that event happens, now it's time to activate the protocol to set up the hotline? You have to consider within your plan, who's going to do that? Who's going to set that up? How is that managed? And how are you going to message to the employees or whoever the stakeholders are that it's now activated, and that's where they can get more information. Now, you have to consider that if you're talking about a live hotline, this can be something that can be fairly labor intensive, depending on the size of the organization or the amount of people that may be calling in. You have to be aware of the fact that you may not be able to vet the people that are calling in. So you have to be considerate with the information that you have available on the hotline, so that you're not providing any information that you wouldn't want the public to have. So, if you're talking about anything that may be more of a security issue, guarding that. So if the media calls the hotline or somebody else, you've got the ability to sort of rein in the information that would be shared on there. And there are third parties that manage hotlines. So, if you set one up and it seems like there are lots of questions coming in, people are asking, I don't feel well, what should I do? Or, this is what my kid's temperature is. Or, I sat next to a guy who sneezed today. Am I sick now too? Anybody who's seen Contagion knows how quickly people can start freaking out about stuff. And at that point, it may be something that you'd want to turn over to a third party and say, okay, can you manage my hotline? Because I either have too many people that are out sick, or the demand is just beyond, my ability to manage it at this point. So if you've got 20% absenteeism, you're going to have to predict that you're going to have 20% absenteeism on the people trained to run the hotline as well. So just considering that.
And do you see that with people who set up hotlines, that they actually have employees calling in asking for health information?
I don't think we've ever seen, if we're talking about a truly, a true pandemic, I think we're going to get to that point. Because again, there's going to be lots of misinformation, and especially if they feel like the company has done a lot for, it has been very forthcoming in either providing information or flu clinics or things like that to help keep their employees safe, then I think they may be more likely to receive those kinds of questions. Now, they certainly can redirect them to a public health department or a doctor, but it's just a question of the resources you have to put into a hotline, and then knowing where sort of the line is of the questions you can answer versus referring them out or having somebody else manage the calls.
So my next question is, in terms of your emergency preparedness plan for pandemics, how do you also address customers and suppliers and vendors?
So, when we're talking about communications, really looking at going back to what is it, how is this going to affect my ability to function? So when you start thinking about your suppliers or vendors or your customers, if you've got an output that they're relying on, you're going to need to understand what their plans are. So if you're relying on something coming in that's critical to your operations, whether it's parts, whether it's information, you need to understand what their plan is so that you can adequately, that, okay, they don't have a plan. We may be delayed on X, Y, or Z. If we can't get this data, what does that do to our operations, and how do we mitigate the effect of that? But, if you've got somebody really that's critical, and if you're a larger organization, you may want to try to provide some services to them as well. So if you're pushing information out to them, it may be one less thing that they have to do internally. If you're organizing a flu clinic, you can think, does it really create that much more demand if we include some of these suppliers or vendors in there? And then I think having an open and honest conversation with them about communications. So who should you be reaching out to for updates on what their status is during an emergency? Who's the best person for your organization to reach out to? And all that needs to be in the plan. And like most plans, you have to assume that the person who's going to have to do this isn't the person that's going to write it. So you need to have enough information in there that you can say, here are the critical suppliers. Here's what we know about their plan. Here's what we expect to do for them, or how we'll share information with them, and all that needs to be documented within the communication plan. But again, don't think too much about the formatting of it. Think about more from a perspective of just gathering that information and making it usable, so that if you ever have to refer to it, it's there and it's comprehensive enough that somebody can get the answers they need.
And you mentioned a little bit ago that we will have some warning about pandemics, that they move pretty quickly from a health standpoint, but in terms of business impact, that people will have some warning. So what organizations should folks be monitoring to understand what the emerging threats are?
Yeah, so obviously, I think our first default thought is always CDC. The one thing about CDC is that they've got a fairly thick process. I don't know a good way to say it, where once they get information, they have to vet it, get it approved, and then push that information out. So, I would never recommend just one source of information. They've definitely, their mission is to prevent the spread of diseases. So they're going to be actively pushing this information as soon as they have it, and they can verify what they need to. My first stop would be your local public health department, and that's something that I would suggest to everyone, is to develop. Everybody has a preparedness coordinator within their community, usually at the county level. In some more rural areas, sometimes it's at the regional level. And I would develop a relationship with them. I would call them on the phone and say, hey, what do you do? How can we benefit from what you guys are doing? And they very much like that. Public health people are really about the community. So they would be happy to work with you to understand, if you want some sort of heads up on what they're seeing from, flu tracking, or, they get all the reports in from local doctors, so they know what flu is circulating. It's public information. They can certainly provide that to you. So that you can, make whatever decisions. So as you decide how you want to manage the communications with your own employees in your own organization, having that relationship is just going to be that much, really strengthen that relationship. And I can tell you, back in 2009, when we faced the H1N1, a lot of companies did end up developing relationships with their public health department because there was such a limit on vaccines. So some have maintained that relationship, but if running a flu clinic or providing information to employees is going to be important or something you want to do within your strategy, a lot of that can come from the public health department, and they'd certainly be able to, they'd be happy to talk about that with you. The CDC also has an organization within it called the Office of Public Health Preparedness and Response, and that's within the Division of State and Local Readiness, or actually the other way around. The division is within the office. And their job is, they've got regional directors out across the country. So those are another, sort of direct contact to CDC, but they're more familiar with what's going on regionally. And those folks have been installed within the last 2 years, I believe. So, that's another person that I would suggest, really developing some sort of relationship with, understanding what resources they may have that you may find useful. And then, obviously, we hear a lot about the WHO, the World Health Organization. They are the ones that set up the pandemic and epidemic. They've got a threat assessment level for ongoing diseases. They monitor diseases as they sort of track around the world. They're working with the scientists and physicians around the world to really understand what they're seeing locally. They support a lot of the in-field testing. If anybody's really interested in what they do, the Science Channel has a new series out. I believe it's called Silent Killers. Let's see. I have it here. Invisible Killers. Okay, Invisible Killers. And if you just look that up on Science Channel, they've actually got it's a series of different. They've got one on influenza, and there's a whole section right on their website that'll tell you the role of the WHO within, as it pertains to flu. So you can kind of get a sense of what they do, but they've got a lot of information that they push out and work closely with the CDC. But ultimately, all that trickles down to your local public health. It just depends on how much you want to be looking forward. So if you want to know ahead of time what this may look like in the upcoming season, a lot of us are already looking around to, like I said, Australia, the Brisbane flu, which is sort of what kicked off last year. It's been around for a couple of years, but it just seems to keep getting worse. And they've already decided what's going to be in the flu vaccine here next year, what strains. So, it's certainly a year-round consideration, but places like the WHO will give you a much longer view into what's going on, versus your local public health will be far more contained to, really what's going on locally.
Great. I never actually considered that, but I'm sure that because it is winter, it's about to be winter in Australia, they're entering their flu season. So that must be why they get such a nice preview of what we have coming for our flu season.
I was at a business continuity conference recently and actually had a spirited argument with an Australian about whether we get the flu first and give it to them, or whether they get it first and give it to us. But it does track pretty well of monitoring each other's seasons and having a good sense of what's coming next for them.
Fascinating. Okay, so when it comes to pandemics, I think everyone, they reach for remote work as like one of the first toolkits to keep, a contagion from spreading around the office. What are some questions that companies can ask, when they're thinking about setting up remote or secondary working policies in the case of a pandemic?
Yeah, and there's been a lot of attention to this in the last couple, probably in the last 10 years. Really, H1N1 set it off because we had such a fear that it was going to be a widespread flu. You have to look at how interdependent your employees are. So if you have a group of people, let's say manufacturing, they definitely rely on one another. So remote work, it's very difficult when you're talking about, you need to complete A so that I can add on to, B. Obviously, that's not the case in something like computer code that can be managed electronically. but really looking at what are those employees that are really interdependent, that really need to be physically near each other, at least within the same location, and then how do you manage them the best you can if you need them to keep working. With the advent of technology, we're doing a conference online right now. We work with people all over the world all the time. So we've certainly got things like Skype and video monitoring and conference calls that are relatively inexpensive, and make it much easier for companies to distribute their folks around. It does get a little difficult when you have a company that's really hesitant, and says, how do I know people are actually working? What if they're just home with their dog? And one of the best responses I've seen came from Richard Branson at Virgin. And he said, if you don't trust your people to work from home, they shouldn't work for you. And I thought that was a really interesting perspective of, if you don't trust them that much, then you shouldn't have them as employees. So really being able to think through the idea of, what are some of those things that can easily be relocated? What support do I need to put in place, whether it's, additional conferencing lines? Gone are the days of having to set up a virtual, a private network that everybody dials into. We've got better security. So it's a little bit easier to do on the fly. There are lots of services available. If you're dealing in a secure environment, it gets a lot more difficult because people can't, have the data with them if they're not secured. So that, if you're working in government space or contracting, that tends to be very difficult to figure out a work from home strategy there. If you've got people that absolutely can't work on their home or on their work at home, you can look at things like, what haven't we taken on because it just wasn't a priority? Was there research we needed to do? Do we need to catch up on blogs? Do we need to do some competitive research? Do we need to write white papers? Do we need to publish articles? What are those things that really contribute to the business but maybe not to the bottom line that we've put off? And can I take some of those folks that really are interdependent and have them focus on something like this in the meantime? A lot of times if you give them a discrete project, then it's something that they can work on, come back and really still provide value to the company. Again, you also may have people that are interdependent, but they may not have those skills. So as a company, it's great to think about this ahead of time of what are you going to do for those folks? So if you've got people that are manufacturing employees that earn an hourly wage and are really skilled in what they do, but not necessarily transferable to another project or another type of work, what are you going to do as a company? I've seen companies where they'll suspend sick leave. So if you take sick leave over a certain course of, over the next 30 days, as long as it's documented that you or someone you were caring for was sick, then it doesn't count against your sick time. If you fall in this department, which is manufacturing or, working on a floor, then we're going to say that we'll pay your salary up to 30 days if you're out sick or once, while the factory is closed. But really it's up to the company to think, what's my personality as a corporation or as an organization going to be towards this? And, it really does come down to who do I want to be, and what do I want to provide to my employees? And thinking about that ahead of time. So it's not an emotional decision. It's not something that comes out when, the vice president's kid gets sick or, whatever it is, but it's really thought about from a corporate policy standpoint, prior to the event. And then just making sure that you've got the ability to support that. You see right now in government, a lot of government employees are doing work from home. The CDC is up to half time is from home, is teleworking, because they're so limited on physical space. So, it's definitely getting to be more acceptable, and it's much easier to figure out before the event than during.
And it sounds like, figuring it out ahead of time also, not only does it save you from making the emotional decision, but gives you a chance to communicate that to your workforce. So would this, part of deciding these policies is that, does this get built into your communications plan so that people are aware of ahead of time what would happen, should a pandemic hit?
Yeah, I think that's a great point, and also, clearing those things with, whoever your legal department. So if you've got a certain number of people that you're expecting to deny work from home, it may not be the people that are necessarily earning the top dollar. So you want to make sure that it doesn't look arbitrary, and it doesn't look like it's singling out any one group. And I would make that decision with the managers at a pretty operational level, that are working with these folks on a regular basis, and figure out how best to roll that out as information, and then how to work with communications and legal to make sure that you're spinning it so that you're still providing them with an advantage, and it's being done as a benefit to the employees, that they're not going to be, you're going to limit their ability, their exposure, or you're going to limit their likelihood of getting sick at work. Because if this gets serious enough, you'll see schools closed, churches will be closed, concerts will be canceled, anything with large gatherings. So, adding on top of that, a sudden change in employment would definitely rattle people. So the sooner that they can know about that during a calm time would be good.
Great. So I want to ask you about, what happens if a pandemic hits that has a serious impact on the workforce. So, if people are actually dying from a pandemic, how do you approach, your strategy when, you might have 5 to 10% of your employees passing away?
Yeah, that's definitely. I mean, that's the day we hope none of us ever see. Like I said before, unfortunately, we are going to see this coming to some degree, and it's going to affect the whole world. So this is going to be a widespread event, and likely by the time it gets to a certain area, people are going to be well aware of the fatality rate, and how sick people really are getting. And it's not going to come as any great shock to them that their employees, their friends, their work husbands, that people are actually passing away. It has a tremendous impact on an organization. And the one thing that you want to be careful of is that people definitely build relationships well beyond their immediate work environment. So, it may not just be their department where people know each other. It could definitely be people across an entire organization. And one of the best practices is really to let people grieve. So providing them time to mourn, where they can go sit and talk to other people. So whether you have a chaplain that would be available, or create a quiet area where people can go. This is assuming that people would actually be at work, but this is where your employee assistance program would come in very helpful. But it's thinking about, and again, from a corporate standpoint, it sounds a little cold, you have to decide what your personality is going to be. So when the first person passes away, you're tempted to say, oh, here, we want to do so much for you. But you have to think, if 10% of my employees pass away, I have to be able to do that same thing for everybody. So thinking about, from that standpoint, what their reaction is going to be to fatalities. And really, you're certainly not going to divulge the name of people that have passed away to other employees, unless that's something that the family would want. But there are lots of technologies that you can set up where people can communicate back and forth and provide support to each other, that would let that sort of happen organically, where you're supporting it but not necessarily facilitating it or putting in personal information about anybody.
And I also want to ask you about training. So once you have a really solid pandemics communications plan in place, how do you communicate that plan to your employees? And do you need to train with it like you might, do an evacuation drill?
Yeah, you certainly, your communication plan, I think, is going to be the part of it that you need to communicate to employees is let them know that you've been working on a pandemic plan, and what the company is going to do during a pandemic. And really that goes to the idea of, wow, they're thinking about these things. They, care about me as an employee. They've got, they're considering these things. I feel good about that. What you really want to do is emphasize how you're going to communicate with them. And you could say, we expect that during any other emergency, we would use our alerting system, corporate email. Here are the ways that we would be pushing information to you. And I would use that to communicate things like flu clinics and, or, wash your hand reminders or whatever it is that you're going to push out about this. I would use those same channels so that people get used to receiving information there and they know during an emergency that's where they should look. Again, a pandemic is going to be a relatively slow evolving event. That's something you can continually remind them that, if we end up with a lot of people that are out sick or if we decide to do an alternative work schedule, here are the ways that we'll communicate that with you, and reinforcing that with them. Now, as far as training, there's really not too much training other than you're certainly going to want to train the people that are responsible for pushing these messages out. But one of the more interesting ways to do it is exercising. If we've got anybody that's on the line from California, there's a statewide exercise that public health runs every year, and that's something that the private sector can get involved in. So you can play along with their exercise and practice, see how your plan stacks up, and then be able to, not too much lift on your end as far as planning something like that. You can certainly talk to your local public health. They have to exercise. Hospitals and any healthcare facility has to do an emergency exercise. You certainly could play along with them and just say, hey, can we see your documents and how you're going to do this, and run through our plan as well. And then just letting people know that it's a test and see how it goes. But I'm a big fan of jumping onto somebody else's exercise when it's possible, just because it's easier, it's more robust, and it takes fewer resources away from the organization itself.
Great. And that brings me to the next point, which is Meg has put together a really great compendium of resources on pandemics communications planning. And we have bundled these up into a 3 to 4 page downloadable PDF that we're going to be sending out to everyone who's attended the webinar, along with a link to the recording tomorrow. So be looking out for that in your email. So there's going to be full text links to all of these. Meg, is there anything that you want to highlight specifically about any of these resources that we'll be sending out?
So within the pandemic tracking, if you are so interested in ProMed, it's a free international listserv. They'll send stuff out. So again, if you're looking longer term or you're just interested in these things, you can select the things you're interested in hearing. I sign up for all of them because I think they're interesting. So it just sort of depends on which ones you sign up for. But you'll get notices of avian flu and all sorts of stuff that they're currently looking for. Obviously, the CDC has their flu report. Google even has their flu, I think it's flu near you. So it just depends on how much you want to look through those. For the communications guidelines, I'd highly recommend anybody that's starting out or really wants to dive more into the communication stuff, really look at the crisis and emergency risk communication guidelines that the CDC put out. They've got amazing resources. A lot of them you can order for free. All of them, they have PDFs. They've got them in multiple languages. And it really talks about how should you be phrasing certain things during a crisis, because people process information differently during an emergency. So really understanding if you don't have a professional communications person, particularly one that does crisis communications, then you're going to want to sort of refer back to that. They've got a training course online, but then they've got a lot of great resources as well. And if you order the book, I think there's one on the shelf behind me. I think it's about 1.5 to 2 inches thick. So I highly recommend the course. It's a little bit shorter than reading the book, but lots of great resources there.
Awesome. Well, thank you so much for putting this together for us. It's full of really great things. So now I want to open it up to any questions that we have from the audience. We've already got one that I want to start with. If an organization is struggling to get buy-in from leadership to either develop or exercise communications plans, do you have any advice?
Yeah, definitely. So often this isn't something that leaders want to think about because they know there's going to be some sort of like negative, something that they don't want to deal with right now. And one of the best strategies. So when I go and work with leaders on this, one thing I always do is show them examples of when this has gone well, and then examples of when this hasn't. So probably one of the best examples to show somebody would be the president of BP Oil after during the investigation after the oil spill. He was caught saying, I just want my life back because he was irritated that he had to cut his vacation short to testify. There's a lot of negative impact on organizations when leaders don't know how to communicate properly. And then you've got instances where Rudy Giuliani after 9/11, his ability to come out and say the right things was unbelievable, and he calmed a city down. Granted, that was a no-notice event, but he had crisis communications training 2 weeks before that. So that's how he knew to come out and say the right thing. So I think being able to emphasize to leaders that, there is a significant impact to the organization on communications after an event and how the company handles that. And it's a real opportunity to improve the corporate image by putting forth a real community partnership appearance and caring for employees. You can see a lot of press from places like TJ Maxx in the wake of Hurricane Maria. They're still paying their employees even though there's not a store open, versus some companies that went on to social media and said, hey, does anybody know where any of our employees are? And that was a big snafu and one that reflected very poorly on the organization itself, that they had no control over, over their own employee monitoring. So they definitely took a hit for that. So I just like to emphasize that with the leaders, and that kind of helps them realize that, okay, yeah, there's definitely a price to not planning ahead for this stuff.
And we have a couple of other questions about the flu. So what lessons do you think that companies could take away from this year's severe flu season? And do you think that we're going to keep experiencing severe flu seasons, or is just isolated to this year?
Yeah, I think one of the lessons for this year is that one of the lessons is we were told it was going to be bad, and a lot of people with message fatigue, H1N1 and Ebola did a lot for reducing the ability or the willingness for people to really listen to this kind of stuff. So I think that's one thing that companies really should be looking at is how am I going to get my message across, and how am I going to make it matter when it is a more severe flu season. It was terrible this year. We had a lot of absenteeism. I think a company, especially one that's been harder hit, should look at alternatives of, what are some ways that maybe my employees wouldn't have been as effective? Should I have given them guidance not to go to, large gatherings? There's a great example from the Spanish flu in 1918 of, I believe the book is called A Tale of Two Cities. And it was during a presidential election, and there was this rally. There was one to be held in St. Louis and one to be held in Philadelphia. And they had, or it may have been a war bond. I think it was war bonds. And there was this huge rally planned in both the cities. And they decided that St. Louis said, people are way too sick. We're not getting everybody together. This is ridiculous. And Philadelphia actually went ahead and had it. And Philadelphia, I believe, had almost 5,000 people die on the same day. And the was astronomical. So I think really looking at what did I do this year and what was my absentee rate, look and see, talk to your local health department and say, on average, how many people were absent from school or from businesses, and see, did you do about the same? Did you take any proactive steps? So did you have a cleaning crew come in and, spray down doorknobs and phones and keyboards and things like that every night? Is that something that would have helped? Who could you have done without this year if you wanted to do work from home or alternative scheduling? So, I would just look at those types of things and then see, is that something you want to implement for the upcoming year? Because again, it's April, so we've probably got about 5 months to really start thinking about this again.
And what responsibilities do employees have to quarantine themselves when they think that they're getting sick? Should companies expect employees to disinfect their own workspaces to stay home, or is there something else that they should be doing?
I think that's a conversation to have with employees and really start a dialogue of if we don't want you to work when you're sick, what can we do to support that? So whether they make it mandatory that, you may get to the point where people have their temperature checked, just like we did with Ebola, when people are getting off an airplane, you're checking their temperature. If you're that concerned about it, it may get to that point. But I would have the company say, look, here are our guidelines. If you're coughing, if you have X, Y, Z, we don't want you at work. I think I would seriously look at extending sick time leave so that people would be able to feel comfortable in staying home. And then, potentially even punishing people that do come to work that are sick and have some sort of negative, whether you put them in their own room, they can't work in the office, like the nice restaurants do. If a guy shows up without a jacket or a tie, they give him like the bright green one, and so everybody knows that that he didn't follow the rules. But I think I would talk to the employees. Now, as far as the physical environment, I would take that on myself as an employer to make sure that those are cleaned appropriately, because ultimately it's my company, my business, our bottom line, and everybody will be affected if we have widespread infections and sickness and worse. So that would be my recommendation.
Well, thanks. I think that's actually it for the questions, unless any others are coming through. Oh, no, I see one more. Okay, actually two more. From a municipal administration perspective, would the communication plan also be affected if expanded to include the community, or should a different plan be designed?
I think I probably would do a little bit different. I certainly would include them, but just as a different set of stakeholders. So you've got as a municipal administration, you're probably going to be dealing with a lot of issues, especially if you're managing any sort of infrastructure, water and sewer, roads, things like that, that you really can't just say, hey, we're not going to, treat the water this week. So that would definitely be a different conversation and communication than you would necessarily have out to the public, which may be more generic of, you may see we're going to cut back to garbage pickup once a week. We're asking people to, burn their yard waste this year instead of putting it in the road, whatever it is. So I think I would make it a little more generic and make the stuff going out to the public really focused on actionable things. So what you want them to do, sort of giving them not necessarily a task, but it's action related rather than, 20 people in the community have the flu, or, if you want to pass along information, certainly, but then reminding them if they don't feel well, what you want them to do about it. So do they go to a doctor? Is there a special flu clinic that's been set up that's separate from regular health care so that people aren't cross-contaminating each other? Just really depends.
And then one last question. It's a request for resources. Do you know of a quick start guide for executives to use during or post a crisis, more like a consolidated crisis management communications plan?
Yeah. So within that the crisis communications or the crisis and emergency risk communications, there are there are little wallet cards, and then there are I don't know what you officially call them. They fit like the size of a business card, but they unfold. So those are quick guides specifically for they've got them for people that are going to go leaders that are either going to make a statement or have to address the public or their own organization. And it talks about the 5 key points of what they should be emphasizing, things to say, things absolutely not to say. And I would highly recommend grabbing those. The ones you can actually order from CDC, and again, they're free, are plastic coated. And I used to have a whole bunch of them, and I would always hand them out. So I would recommend, if that's something that would be helpful, but look through there. They've got a lot of leadership stuff. But the plastic coated ones, obviously you're not going to want to print that out yourself. So I would order those and have those available. And then I always recommend that leadership in an organization, as the group, go through crisis communications training, especially something that would have an exercise component to it, where you can kind of theoretically test your existing crisis planning so that you know where your weaknesses and things are, and then are able to address those prior to an event. So it's especially for leadership, it's especially important for that to be done as a group rather than individually.
Awesome. Well, thank you so much, Meg, for joining us today. This was a great discussion. So thanks for sharing all of your knowledge and for helping everyone, build these communication strategies. We really appreciate it.
Absolutely. Thank you for inviting me. And you guys have my email address. If there's anything that you're looking for, resources-wise, please don't hesitate to reach out to me, and I'll do whatever I can to find it. And provide it back to you if it's not something that's already included on that resource sheet that you're going to get.
Thanks. I want to remind everyone on the call that we have built this emergency preparedness assessment tool. We here at AlertFind are really proud of this. It's a 10-question assessment. It takes less than 10 minutes, and what you'll receive is a tailored advice to help you take your emergency preparedness plan to the next level. It's some really solid thinking about emergency preparedness, and quite a bit of it is about your pandemic preparedness. So if you're interested in taking the assessment, it's available on alertfind.com in our resources section. And then you'll also be receiving from us later today, I believe, an invitation to our next webinar. We are really excited about this one. We're going to be talking to Jeff Trask, who ran the emergency communications during the aftermath of the Boston Marathon bombing for all of the MIT campus. And he is going to take us through how he prepared his emergency notification templates so that he could be, quick acting, and how he worked with the campus to keep everyone safe during a really chaotic event. So we're really looking forward to this one, and you'll be getting an invite from us for it. And then as a reminder, AlertFind is an emergency notification system for business continuity professionals. If you want to schedule a demo, you can do so on our website. You can also just drop me an email and we will set it up. And also you can contact Meg Nash. Her contact information is here on this slide if you have any additional questions or follow-up. And I just want to thank everyone, especially Meg, but everyone, for coming today. And we look forward to seeing you at our next webinar. So thanks, everyone.